Most common cause of coagulative necrosis: A. Tuberculosis, B. Ischemia infection, C. Fungal infection, D. Trauma. Answer B. Ischemia and infection. Caseous necrosis is classically seen in A. MI, B. TB, C. Gangrene, D. Fat necrosis. Answer TB. Which cell is the hallmark of acute inflammation? A. Lymphocyte, B. Plasma cell, C. Neutrophil, D. Macrophage. Answer is C. Neutrophil. Giant cells are commonly seen in acute inflammation, granulomatous inflammation, viral infection, edema. Answer is granulomatous inflammation. Most potent vasodilator in inflammation: histamine, bradykinin, prostaglandin, leukotriene. Answer is histamine. Which vitamin deficiency causes scurvy? Vitamin A, vitamin C, vitamin D, vitamin K. Answer is vitamin C. Apoptosis is characterized by cell swelling, inflammation, cell shrinking, membrane rupture. Answer is cell shrinking. Most common tumor suppressor gene: RAS, MYC, P53, HER2. Answer is P53. Guardian of the genome is RB gene, APC gene, P53 gene, BRCA gene, P53 gene. Most common malignant tumor in females worldwide: cervical carcinoma, breast carcinoma, ovarian carcinoma, endometrium carcinoma. Answer B. Breast carcinoma. Reed Steinberg cell is diagnosis of NHL, Hodgkin lymphoma, leukemia, myeloma. Answer is Hodgkin lymphoma. Philadelphia chromosome is associated with AML, ALL, CML, CLL. Answer is CML. Hyperplasia means increase in cell size, increase in cell number, decrease in cell size, cell death. Answer is increase in cell number. Metaplasia is irreversible change, malignant change, reversible replacement of one another type. Cell death. Answer reversible replacement. Most common site for atherosclerosis: veins, aorta and large arteries, capillaries, venules. Answer is aorta and large arteries. Virchow stride includes all except endothelial injury, stasis of blood flow, hypercoagulability, hypertension. Answer is D. Hypertension. Most common cause of edema: increased hydrostatic pressure, vitamin deficiency, infection, trauma. Answer is increased hydrostatic pressure. Which pigment accumulate in smoker lungs? Bilirubin, hemosiderin, erythropoietic pigment, lipofuscin. Answer is erythropoietic pigment. Nutmeg liver seen in hepatitis, right side heart failure, cirrhosis, fatty liver. Answer is right-sided heart failure. Most common type of shock: neurogenic, septic, cardiogenic, hypovolemic. Answer D. Hypovolemic. Like and subscribe for more.